Good morning, everybody. Welcome back to the program. It's 11 minutes past 8 o'clock right now. Lou and Michelle here, being joined by Jake Roberts. He's from United Healthcare, Medicare, and Retirement in Iowa, talking about a big event that's happening. Actually, a big event that ends tomorrow. Wait, listen.
The clock is
Almost
ticking.
here.
Clock is
Almost
ticking.
here.
What are we talking about, Jake?
We're talking about Medicare's annual enrollment period. It's that one time a year that people have the ability to change their Medicare coverage for the next year. It ends December 7th.
It's tomorrow.
Yes, tomorrow. And you have to make a decision to change by the end of the day tomorrow. So you've got till midnight tomorrow. Still a little bit of time. I don't want to scare people or freak them out or make them feel overwhelmed. If you haven't made a decision yet or you haven't even started looking yet, that's okay. You're not alone. These are our busiest 2 days of the annual enrollment period. This is the busiest week of the annual enrollment period.
So you guys are ready for that, aren't you?
We are, yes. We expect people to be calling and visiting our web pages and looking for that information, understanding that they need to make a decision within the next day.
Okay. Now, we want to stress the fact that you really should be looking over what you have and what is covered. And how many times, Michelle, you hear people say, well, I'm not going to worry about it because it covered everything that I needed.
Right. It's a really common thing. Nobody likes looking at their insurance, right? It's not a fun. Yeah, it's not a fun thing to do. And so seniors want to set that Medicare and have it be a set it and forget it, and I never have to look at it. That's not the way that you should approach it. I highly recommend people look at their plan every year. Plans can change. Their plan can change. New plans can come into the market. Other plans can change. A lot of things can change, which could lead your plan to not be the best plan for you for the next year. And if you don't make that change, you're locked into that and you can't make a change throughout the year.
Now, things that could change in the plan that you currently have, maybe the things that were in place in 2019 that you were very accustomed to, that you're very satisfied with, well, maybe one of those benefits is changing a little bit.
Right.
Or maybe it's not going to be there. Or, on the other hand, you might have an additional benefit that could come into play too, which is usually the case, isn't it?
Exactly, yeah. So costs can change, premiums can change, or co-pays, deductibles, things like that can change. Extra benefits can change. Prescription drugs can change. All of that stuff can change. And it can change not just in your plan, but in other plans. So even if you're happy with the plan that you have right now, make sure that it's still the best plan for you. And that might be the case, but that might not be the case either.
So for those people maybe that are just now starting to look at things and, these last couple of days, what tips do you have to help them kind of navigate through this?
Yeah, like what you'd be looking at first.
Right. So what I'd recommend is just the understanding first that it's not a huge process to understand what your options are. So first, look at your current coverage. Does your coverage still meet your needs from both a cost standpoint and a benefit standpoint? Are your prescriptions still covered? Are the benefits that are important to you, like dental, vision, hearing, still covered the way that you want them to be covered? That's the first thing I would recommend. Second, I'd think about those extra benefits. What are important to you? Do you want dental coverage? Do you want a free gym membership? Things like that. And then finally, take advantage of the wellness programs that your plans have. United Healthcare plans, for example, have a benefit called Renew Active. It's a free gym membership, but it's so much more than just a free gym membership. So not only do you get a gym membership to places like the Y here, you also get a free walk through a session with a trainer to understand how to use that equipment, a brain health program so you can stay fit mentally as well as physically. And our plan this year actually can help you achieve your fitness goals by giving you rewards. We'll pay you up to $115 a year for doing things like meeting step goals or going to the gym.
Oh, really?
Yep. And we actually have a plan here in the Des Moines area where you can get a free Fitbit, just like the one I'm wearing right now.
You must be.
So really, there's a lot of benefits that people maybe just aren't aware of, too, that they want to be able to take advantage of.
You mentioned the Y, which is the go-to, which is an incredible facility. They have so many different programs and stuff that's there, but there's other places, too, that you might not realize that are involved in this plan as well.
Yeah, so Renew Active Gym, or the network is very large. It includes places like Aspen Athletic, Curves, 24-hour fitness, Snap
I
Fitness.
never realized that.
Yeah, it's a real, the great thing too is you can go to any of the facilities at any time. You don't just pick one. So if you've got,
Oh, really?
Yeah, right. The Y up here has a class on Tuesday you like, but this place has a pool that you like. You can go to both of them.
We're learning something here.
That's great. And then, and Katie was here the other day and talking about the house calls,
Right.
and how you have access, making sure that you have access to the care that you need when you need it.
Right. So those are things that people don't necessarily consider or think about when they're planning.
Right.
United Healthcare really it goes out of our way to try to help people live healthier, and our plans are built in that way. That house calls program, we'll send a nurse practitioner to every member's house once a year. We have literally saved people's lives. We have a member here in Des Moines. Her name is Betty. She was on our plan. The first year she was on our plan, she had her house calls visit. They found she had blockages in both of her carotid arteries.
No way.
We got her to her specialist. She got on the other side perfectly healthy. We stopped her from potentially having a life-threatening stroke. Betty told us she loves spending time with her grandkids. Well, without that house calls visit, maybe she doesn't get to spend that time with her grandkids. Maybe she doesn't get to go run around and have fun with them. So, think about more than just, co-pays and out-of-pocket maximums when you're looking at a plan. Find a plan that can help you meet your health goals.
Right, and we're talking about a lot of people that are turning 65, aren't we?
Right, yeah. So Medicare serves over 60 million people nationwide right now. Over 10,000 people a day are turning 65, which has helped the growth in Medicare Advantage plans because they offer a lot of value. People really like Medicare Advantage plans because they're convenient. You've got one card that you're using instead of multiple cards. It adds things like the prescription drug plan built right into it, so you don't have to pay additional or get a separate prescription drug plan. Plus, it adds those extra features in there that Medicare doesn't cover, like dental, vision, hearing.
Okay, let's stop at that last one because that is really an important one, and
Right.
we've learned about how important hearing is to the mental well-being,
Right.
as well as everything that people that are getting older have to do in their lives, and the hearing is part of that plan too. Explain how important that is.
Yeah, so hearing is something, hearing loss leads to a lot of other health issues, including depression and things like that. So more than 50% of seniors have hearing loss, don't necessarily understand that Medicare doesn't cover hearing. So those people that need access to a hearing aid benefit, our programs offer that, a no-cost hearing exam, and then a hearing aid benefit where you can get hearing aids for as low as $375
Which
for a
is
set of hearing
unbelievably
aids.
low.
Yeah, it's
incredibly low.
Yep. So we give people the option to, order over the phone or online, or go into a facility here and choose which level of hearing aid you're looking for.
And how much additional will someone be paying out of pocket roughly if they want to sign up for an Advantage plan as opposed to regular Medicare?
There are a lot of Medicare Advantage plans available. United Healthcare has plans here in Polk County for $0 in additional premium.
$0 additional.
Right. Yeah. So
it doesn't cost you anything if the plan works for you.
right. So that's part of why we're seeing so much growth compared to original Medicare. It doesn't have the extra benefits. Original Medicare, you're generally going to have to pay for 80 or 20% of the cost
Right,
of
which
your
is
care.
still a lot.
It is, and you have no maximum limit for the year, so you can keep paying and paying and paying. Medicare Advantage plan, lower, more predictable costs, no additional premium in some cases, plus all those extra benefits that people are looking for, like a personal emergency response system is one that we have through Philips Lifeline. So we've got
Really?
benefits to meet everybody's needs.
I haven't even heard about this. We're learning more and more
Right.
about this.
Yeah.
But what you need to do, if you haven't checked, what your plan is all about yet, you still have today and you have tomorrow. And how do they get a hold of you guys so you can just run them through the paces?
Yep. So one way to get a hold of us is to call our call centers. You can call 800-707-3914.
Okay.
You can go online as well to uhcmedicarehealthplans.com to check out the plans available
Right there
in
on
your
the
area.
screen, you see what it is there?
Yep, you just type in your zip code right there and it'll send you to a screen. It'll show you what types of plans we have. United Healthcare doesn't just offer Medicare Advantage plans. We know that that's not the best for everybody. We offer Medicare supplements and prescription drug plans as well. We want to be able to meet the needs of every consumer.
It's a no-brainer. It really is, especially with the things you talked about here today.
Right, yeah, and like I said, you're not alone. These are our busiest few days of the year. This has been a really great year for us already as well. United Healthcare is the fastest growing Medicare Advantage carrier in the state of Iowa. We've had over 5,000 people enroll in our plan so far this AEP, and so it's a good time to take a look at what we've got going on.
And it's not too late.
It is not too late. It's not too late to start, and it's not too late to make a decision. It's also not too late to change your decision. If you've made a decision and you're not sure that that was the best decision, you can just make another decision. The last decision you make before December 7th.
You can update it. I didn't realize you could do that either.
Yep, the last
You were
decision.
just chock full of information.
You got it.
this morning.
Yep.
That
There
is
to
so
help.
cool. All right, again,
There to
until
help.
tomorrow at midnight to make all your plans, make sure your plans are in place and ready to go for 2020.
You got it.
Thank you so much, sir.
Thanks for having us.
Appreciate
Good job. Thank
It is 8:21 right now, and we will be right back. And when we return here to Iowa Live, we're going to get you caught up as what in the world is going on with Iowa Live.